Sam Hartman, and I'm going to be giving my persuasive speech. Here's my speaking outline. How does it make you feel when you have to wait weeks, months, or even years for something you really want? Anxious? Annoyed? Upset? Well, what if that thing you wanted so badly was something you literally couldn't live without? Well, each day, according to Donate Life America, last accessed in November of 2020, 22 people die each day waiting for that something, waiting for a life-saving organ that they aren't going to get in time. Who knows? The next person added to that waiting list could easily be someone you know. Today, I want to inspire you to give your life meaning after death, to make a difference, and to register to become an organ donor. I myself am a registered organ donor who has done a considerable amount of research on the current organ donor shortage. First, I'm going to express the desperate need for organs. Next, I will explain how you can register to donate to help fix this issue. And finally, I'll demonstrate how this decision can impact both the donor's family and the recipients. I will begin by proving the critical lack of organs through compelling statistics. People all over the United States are currently awaiting transplants, desperately hanging on for a second chance at life. The issue is that there's a large lack of registered donors, and even further than that, a lack of viable registered donors. In April of 2019, Life Center reported that 95% of adults in the United States say they support organ donation. However, only 58% of adults are registered to donate. Now, nearly 60% may seem strong at first glance, but when only 0.3% of registered donors are viable after death, it really isn't all that much, as stated by the Health Resources and Services Administration. This major lack of donors leads to a lack of organs to give out, which results in a high death rate in transplant patients. There are simply not enough organs being donated to save the nearly 115,000 people on the waiting list that the Health Resources and Services Administration say are on the transplant list as of September of 2020. Because of this, Donate Life America recorded that over 8,000 people die each year waiting on a transplant. So many people are dying due to the lack of registered donors, despite the simple process of registering. Now, I'm going to tell you how you can register to donate and ensure your donation to help save the many lives of those dying every day waiting on an organ. There are two simple tasks that can help solve the organ shortage. The first task, according to Dr. Sabrina Felsen, is to discuss your wishes with your family and loved ones. Letting those around you know you wish to donate your organs following your death allows them to clearly advocate for you. This is especially important if you are under 18 years old, as they will be the first ones asked following your death, and letting them know what you want will help to ensure your wishes be carried out. This discussion has potential to bring up their wishes and opinions as well, which can only lead to more registrations and more donations. The other and even more important task you should complete is the actual registration as soon as you are 18 years old. There are two official ways to register to become a donor, as stated by Dr. Felsen. You can register at the local DMV by adding your name to the state registry, which will also print it on your driver's license. Or an even simpler way to register is online at organdonor.gov, which requires basic information such as your name, license number, and social security number. Registering to donate confirms your donation as long as you are viable, and is a quick and convenient source of consent, allowing doctors to start the donation process as soon as possible. It is very easy to register and even easier to share your wishes with those around you and inspire them to do the same. I have proven to you that it is easy to become an organ donor. Next, I will express the impact you can make by becoming a donor. Donation positively impacts both your family and the family of the recipient. Take, for example, the case of Dakota Reed and how his organs impacted the lives of many. Bernier wrote that Dakota was only 16 years old when he died in a car accident, meaning the decision was ultimately his father's. Dakota had previously discussed his positive outlook on donation with his father, so his father knew it was what he would have wanted. His donation provided a 19-year-old family friend with a working kidney, gave a 21-year-old the chance to see for the first time in his life, and gave someone on life support a new heart for a second chance with his family, and many more donations, both life-saving and enhancing. Dakota's many donations gave others better lives and second chances, but they also provided comfort to his family. His father said, beginning quote, "It brings peace and closure knowing my son is a hero, and through a miracle, he lives on," end quote. Your donations can provide a sense of purpose for yourself in the eyes of your family and allows them to move on knowing your death was only to save others. As you can see, organ donation is an uplifting procedure requiring our attention to help give life to those when yours is at its end. I first informed you on the current lack of organs through an urgent need for donors. I then instructed you on how to help change this through becoming an organ donor. And finally, I helped you visualize the impact donating makes on both the donor and recipient's families. I hope I convinced you to give meaning to your life after death. I urge you to register to donate today at organdonor.gov and give others the second chance at life that you were not able to get. After all, you never know when someone you love may need an organ. Wouldn't you want someone to donate to them in their time of need? Why wouldn't you do the same for them? Thank you.